Hello, everybody. Welcome to our March Board of Health meeting. The weather's starting to turn, so I hope everybody's feeling positive and ready for this wonderful meeting. So I'll go ahead and call the meeting to order with those happy thoughts, those happy spring thoughts, as we continue to address our public health issues here in the county. Frank, I don't think we had anybody for privilege of the floor. Is that correct? Okay. Right. So let's go ahead and do our approval of the minutes. We have a whopping 3 sets of meeting minutes to approve from last December. So let's go ahead and go through those in order. Let's start with our December 7th, 2021 meeting minutes. If we can get a motion and a second on that. So we've got a motion first from Shauna.
Second.
A second from Ravinder. Any discussion on those? All in favor as written. Anybody opposed? And abstentions? I think that was everybody. Okay, great. January 25th, 2022 minutes. Motion to approve from Shauna. Second from Sue. Any discussion on those edits, changes? Okay, all in favor as written. Anyone opposed? And abstentions. That was unanimous again. And then finally, our February 22nd meeting minutes. First from Shauna. Second from Ed. Any edits, discussion, changes on those? Okay, all in favor as written. Anyone opposed? And Sue's not opposed, right? You were in favor. Okay. And then I think that was unanimous, so no abstentions. Okay, great. Financial summary. Frank, are you going to handle that or are we? Okay.
Yeah, I believe there was a report in the packet. I don't have a lot to add to it. Brenda is unfortunately out today, but if you have any questions, we can certainly try to field them.
Okay, any questions from the board on there was a financial summary in there. Any questions from anyone on that before we let Frank move into administrative updates? All right, Frank, go ahead.
Great, thanks. It's good to see everyone. Sorry I missed last month's meeting. I got a chance to take a couple of weeks off. It was nice to have a little bit of time away, although the school mask removal happened during that time frame, so it wasn't completely uninterrupted, but I appreciate staff filling in for me so I could take that time. Since I've been back, have begun to transition back into other things besides COVID. Obviously, we're still paying attention to it. Much of what we're looking at now is continuing to monitor severity of illness as we have throughout. Happy to report that there are no active hospitalizations for COVID, and there have not been for the last 3 or 4 days. So that's good news. We're hopeful things will stay that way. We're of course monitoring the variants and their evolution. Did just get an update about half an hour ago from the folks at Cornell. And it does look like from some preliminary screening that the majority of our cases since the beginning of March have been of this new BA2 variant. So we are seeing what the rest of the country is seeing as well. So there obviously will have to do the final actual sequencing before we'll know for certain, but it does look like we are following that trend. The schools are still, working with some restrictions, but masking has, the adjustment to the masking requirements has occurred, and I think folks are managing fairly well. So outside of COVID, I've been spending a good bit of time, spent a lot of time down at the mental health building, getting to see folks again that I haven't seen in a while, touching base, having some meetings. Spending some time working with Mona Lita Smiley. I had a chance to meet with her at the Community Justice Center. That's what we're I always want to call it criminal justice, and I know it's not right. Community Justice Center. She's the new director, and talking about the roles that hopefully public health and mental health will be able to play in those conversations moving forward. So excited to have her co-located at the mental health department, because I think there's a lot that we can learn from her, and hopefully she can learn from us. And I've been doing a good bit of work on the strategic plan. As we begin to roll that out, we'll talk a bit more about the merger later on down the agenda, so I'll save that for then. But it does feel good to be getting back to some other things besides COVID, and really starting to dig back into those. So more coming as we move forward, but so far so good. So that's all I have, Shauna. Christina.
We're interchangeable. That's okay. Thanks, Frank. Any questions for Frank? Okay, Sam, I think you're up next.
Hey, everyone. So just a few things to add to what's in the report. We had a lot of interest for the community health worker positions that we're hiring for. So we're currently reviewing applications and hope to start scheduling interviews, but we really have a wide range of people who have applied, and it's really exciting to get this initiative up and going. It's been a big collaboration with some community partners who are working on similar roles in their organizations, including the hospital and cooperative extension, and then our internally, Claire's team has been working with us a lot also, because we're hoping to have the community health workers really work across the department and probably start with some of the maternal and child health programs. So it's great. And we also have been connecting with existing community health workers in the community, including outreach and other places where they're just a wealth of knowledge who can inform, how we develop our program. So that will hopefully be underway in April. And then we also are in the planning stages to launch the next community health assessment process, which will be due next or December of this year, 2022. So we're hoping late spring or early summer to be launching things like another community health survey, similar to what we did in 2019. And also we're in the process of starting to update some of the data sources that we routinely use in that assessment, but then with our steering committee, we'll be discussing other data sources as well. We had a really good conversation recently with our QAI team at Mental Health about other sources of data that perhaps we haven't included in the past. So I think it will be a really robust process. So stay tuned for more on that. And yeah, I'll also hold off on other integration strategic planning information. So till later in the meeting. That's it. Thanks.
Thanks, Sam. Any questions for Sam? Okay, I think Dr. Claypack is not here today, but he has a very robust report in the packet, and he also included in there just a note that if folks had questions to email him directly, and he'd be happy to respond or work with any of you. So Frank, I would move on to Claire unless you or somebody else is stepping in to do additional updates.
No, I don't have any additional updates, but if there's any pressing questions, I can certainly try to answer them.
All right, well, let's let Claire go ahead and give her update, because I think there's typically some similarities there anyway. And so if we have questions, perhaps we can address them with Claire as well. Hi, Claire.
Good morning. I'm here today with Rachel Buckwalter. She obviously contributes and significantly supports the communicable disease activities we have. I don't really have much to add to our report. Frank already covered the scenario that we're facing with COVID, and we're seeing cases kind of hovering in the 30s, 40s. So we're continuing to monitor the situation and work with the virtual call center. They have indicated that they are ending their contract, so they will no longer be making those phone calls at the end of April, and we're working to kind of address how we'll move forward to support the community in their absence. And I would say questions that came up last month regarding syphilis and Lyme's disease, we've addressed those in our report. And if anyone has any questions, we're happy to respond. Thanks.
Thanks, Claire. Any questions for Claire? And I actually did have one, the virtual call center. That's the ones that have been doing the contact tracing follow-up calls.
That's what, yeah, essentially they weren't doing contact tracing. That aspect of the case investigation has been discontinued because it's no longer effective, but they were calling all the positive cases that were coming in with lab reports. And so they've been doing that.
Okay, thanks. Questions from the group? Sue.
Yeah, so you're still doing PCR testing in the community, is that true? And how long is that going to last? Any plans for doing away with that?
So yes, there is still PCR testing being done at the mall. Right now, the county's plan was to align our payment with payment for people that are, not symptomatic or a close contact to be tested, as long as the FEMA reimbursements were going to continue. So that generally aligns with the federal declaration, which I know they've been doing pretty regularly and for shorter periods of time. So I would imagine at some point that will come to an end. There is, of course, the challenge with the federal government's lack of funding for these things. And so today it was announced that HRSA is no longer taking submissions for uninsured or underinsured individuals for testing or treatment because there's no funding available. So the hospital and other providers will have to, continue to work through their communication chains with New York State to see if there will be supplemental funding from New York State and or will be, kind of transitioning back to what any healthcare provider has to do if they have somebody present that's uninsured or underinsured, and that's trying to get them on Medicaid or onto the health exchange or other ways to make insurance payment available.
All right, Ed.
Thanks. So Frank, I just want to be clear. So the cases that are being counted in the report here are probably 50% of the, approximately 50%, because it's thought that their antigen testing is about 50% more than the PCR testing. Is that right?
Yeah, I mean, I don't know. It's hard to tell because we are collecting. I think if you looked at the totality of Cornell's testing combined with our testing, I think that's giving you probably an 80 to 85% picture of what's happening in our community. There's a lot of self-testing happening. Not a lot of it's being reported to us, but a lot of it is being reported to Cornell because they're required to. So I think 50% would probably be a little too high to say that there's 50% not being reported, but there's really no way to know for certain because there's certainly a volume not being reported.
But it's still low and relatively flat, it seems like.
Yeah, I think so. I mean, I think we've settled into as Claire was saying, what we report is like a 30 to 40 case day. So if there's another 20% on top of that, it's still remaining pretty constant across the board. Now, as we had different events occurring, people leaving town, particularly connected with higher ed, we saw little bits of bumps, right, that would occur because of that. But I think generally speaking, we've hit kind of a stable level. The hope is it will continue to decrease as we go into the summer months. And then, we'll just be preparing for what next fall and winter brings.
Okay, thanks.
Hi, David. Yes.
Do we think that people who are testing positive on the antigen tests are then confirming to get a PCR, or do we think that they're just accepting that as a positive and then, staying home from work and those kinds of things?
Yeah, I think unless there's a requirement for them to follow up with PCR, which technically with the schools that still exists, I don't think people are following up with the PCR. I think most folks are taking the results of the positive antigen test and acting accordingly.
I didn't think they were requiring the PCR as a backup if they're positive on the antigen at Cornell anymore, are they?
No, I meant K through 12. My apologies.
Okay.
Okay. Any other questions on this? All right, let's go ahead and move on to Deb for children with special healthcare needs.
Hi, everyone. I just want to add, as you heard me say last month and the month before, we had a wait list for kids waiting for speech therapy. That wait list continues. I have about 32 kids waiting, and as of last month, I'm now getting a wait list for special instruction teachers for these kids too. I have about 10 there. There was a new covered lives assessment approved by Governor Hochul. New public health law, insurance companies are required to provide $40 million to the state fiscal agent to help cover early intervention services. So I'm hoping that will help with some of the billing issues that can bring some therapists back into the program, although there is a variety of reasons of why therapists have left this program.
Thanks, Deb. Questions for Deb? Okay, I don't see our county attorney unless I missed him. So
no, he's not here, Shauna. We'll check in with them. We do have a new deputy county attorney as well. So we'll check in and hopefully one of them will be able to represent at meetings moving forward. But one issue to just bring up under the county attorney is the need for in-person meetings. So the state declaration of emergency, including the suspension of needing to be in person, was extended through April. But it did feel like there was some question this time about whether it should or shouldn't be extended. And if things continue in the same direction, I'm not sure that it will be extended into April, after mid-April. So that could affect your next meeting at the end of April. So I just wanted to put that out there. I don't know for certain. It may very well get extended again, but I did want to just, make you all aware that we're probably coming on a point in the next month or two where that extension will end and will likely be back in person.
thanks for the heads up. Okay. So Liz, for environmental health, did you have anything in addition to your report?
Yes, I do have a few things today. I don't think I put it in my report, but we have promoted our environmental health technician, Dylan Schultz. He is now our new environmental health specialist. So we're quite excited to have those two positions filled. And now we'll be recruiting for Dylan's replacement to get a new technician. So yeah, I think he started about a week ago. So we'll be transitioning to new responsibilities. Also, we have been working with this group, Zero Waste. The Zero Waste Initiative or program. They're trying to get restaurants to promote bringing for customers to bring reusable containers. So we did send them a kind of blanket letter that clarify that that is allowable under the New York State Sanitary Code for food service establishments. So that they said restaurants were having some concern about our response to this, so that they can show people that as they try to develop this program. So just wanted you to be aware of that effort on our part. We are also proposing some changes to our temporary food program. That's been given the public health risk of a lot of these events, it's a pretty resource intensive program for us. It has been in the past. And we were reviewing the both the food service establishment regulations and the temporary food service regulations. And religious, charitable, and fraternal organizations are not required to get permits from us if they only hold events, I forget, like less than once a week. And we realized that Cornell events fall under this provision. And Cornell also has their own process in place where they track these things, they provide education. So we are actually working with Cornell to have to not issue temporary food permits for Cornell events. We're working with Cornell to get revisions on their websites for some more food information that we would like. And to, I think they're gonna have their participants take our temporary food quiz anyway, that type of thing. But that should be a big help for us in our temporary food program, allow us to focus on some other things that are higher risk. We are also working with Grassroots. We almost have comments ready on their water and site plans. We're dealing with some of the issues that we have in the past where the information that they provide in one place is not consistent with what they provide someplace else. Anyway, so some of the things are continuing, but we are still optimistic that this will be an excellent year for the Grassroots Festival. And the last thing I would like to discuss is some of the vaping stuff that's been going on, right? We, during COVID, our ATUPA program was pretty much back burner, right? So we were responding most of the time on a complaint basis to anything about, ATUPA is the Adolescent Use Prevention Act, for those of you that haven't been exposed to the jargon yet. And we are responsible for trying to make sure that they don't sell tobacco products to minors. And we did this primarily on a complaint basis during COVID. During COVID was also, I think it was March 20th, was when New York State changed, had the new vaping regulations where they're prohibiting the sale of vaping products to minors, and the restrictions on like tobacco. If it's just tobacco, a tobacco vape product that can be sold, most of the other ones can't be sold. So that came out right during COVID. It's complicated because facilities are still allowed to do internet sales to out-of-state customers. I think they have to be out of state. So they can have the product on site. They can't have it on display for sale. So it makes, it can make some, enforcement of it or checking on it more complicated. So our approach has been, we are starting to do our full compliance checks again with these facilities. And our approach to address that issue was we had an adult, not a minor, go in and request a vape-flavored vaping product and to see if they could get it, right? Even if it wasn't for sale. And so you'll be seeing some, we did have a number of sales this way, or violations. And so you'll be seeing those enforcement actions next month. This month, there are two on the agenda. These are for straight selling tobacco products to minors. These were the underage sales. So the more traditional sales were what the two enforcements are this month. And that's it, I think. Anything, let me know if you have questions. I had a lot this month.
Thank you. That was a lot. Yeah, thank you.
Yeah.
All right, any questions for Liz? Shauna?
Yeah, I wanted to ask about the penalties that have been assessed. And, you know, certainly for something like this, I would love to see the maximum penalty if we could do that.
So our approach, so the penalties, there's a minimum penalty for a, okay, so if it is sale to a minor, there's a minimum penalty of $300 and a maximum of $1,500. Since we have not been actively working with these facilities, we are sticking to, there was also, there's the penalty, and there also is a state surcharge under the ATUPA program. That surcharge used to be $50 and it has increased to $250. So we have not significantly increased our penalties. There is an increase because of that increase in the surcharge, but we are viewing this time as our kind of sort of education time with the facility. So we are not proposing the maximum penalties. And we feel like if we see another sale, then we would have much more stringent penalties. That's kind of the philosophy that we are using with these actions. Just so you know, the grant year for this is a grant funded program, and the grant year ends March 31st. So we'll be actually starting a new grant year right on April 1, which will start new rounds of inspections, right? So we can do those at any time. And if they've had a violation, we then do more inspections at that facility throughout the year. So that's pretty much what we do. If it's for next month, if it's the sale of vape products, that's up to $100 for each individual package. And so we reached out to surrounding counties to see what they had assessed, and people generally are not doing extremely high fines. They're kind of keeping the fine level in line with what the other sales are for initial sales. So that's probably what we'll be proposing for next month.
Okay, Shauna, any follow-up to that, or you're good?
I still would like to see more severe penalties. I know typically I go the other way on a lot of the restaurant stuff, but this stuff is really important to me.
Mm-hmm. And Shauna, just so I'm clear, and we're talking about the vaping piece, and the fines you just talked about, Liz, are related to vaping under ATUPA, right? Not the smoking, or okay.
Well, they're tobacco flavored. The two on the agenda today are for sale of tobacco products to minors. So these are the traditional sales that we've had in the past, not just having the banned products for sale. These were actual sales to a minor.
Okay.
And I guess since we are sort of talking about this now, the stipulation agreement that the facility.
Well, wait a minute. I think we should hold off until we're under,
okay, sure,
I don't want to get into the specifics. I think if we're just talking generally about fines, that's good, but let's hold off on that till we're under motions. Okay.
I actually have one question.
Yeah.
Whenever we're talking about minors, are we talking about under 21 or under 18?
Mm-hmm. Under 21.
Okay.
And we're doing the older age now. The state wants us to do the older ages now, so that's who we are using.
Okay. Any other questions or comments on this before we move into the enforcement actions? Okay. So our first enforcement action then is related.
Is there the CSB report? Sorry to interrupt.
Oh, sorry. CSB.
And
sorry,
new business. And new business. Sorry.
That's what I get for scrolling down in my packet too soon.
No problem. So the Community Services Board, it seems like a pretty good topic following what Liz was talking about. Their last meeting, we had a mother and a daughter of someone who had died from an opioid overdose come and speak to the group. It really was focusing on fentanyl-laced, it was a fentanyl-laced drug discussion. And some of the information they shared was pretty alarming about pressed pills that are made by people that are sold illegally, that they have fentanyl in them, and that many of the products that people might be buying illegally are going to be fentanyl laced now. So it's a serious problem and creates a great risk for people for overdose, especially if they've just been discharged from a program where their bodies have been clean of drugs for a period of time, and then they take their typical level, or now they add this fentanyl to it, that there's a chance of death there, or people who don't know that they're using fentanyl. So that was the discussion, and then we focused on representation from REACH and from CARS and from Alcohol and Drug Council. They all talked about what they're seeing as far as the issue in the community, in hopes of establishing next steps. Probably much of that work will be done in our substance use subcommittee going forward.
Thanks, Harmony. Questions for Harmony? Yes, Bill.
Hi, I was here before, by the way, folks.
Oh,
I'm just not a computer guy. I'm very much a 17th century man. I do have a question. I was just reading in the paper today briefly that there's something worse than fentanyl now out on the street, Nant disease or something like that. I don't know if the doctors can understand what I'm saying. I didn't think there was capability of something worse than fentanyl. Anyway, it's something we should keep an eye on, I suppose.
Yeah,
Sounds
Bill, I'm
bad.
not familiar with the exact drug you're referencing, but there was something called parafentanyl, I think at 1.2, which was significantly more dangerous than just straight fentanyl. Fentanyl was in the news, if you'll remember, pretty consistently ahead of COVID, right? It was like a common conversation that we were trying to get messaging out about, and then COVID came along and kind of knocked it out of the news cycle. But it is still there, and as Harmony said, you know, if you're purchasing street drugs, regardless of what they are, you should just assume there is fentanyl involved. And you know, on top of the problems that Harmony issued, for someone that might not be using an opiate, to then have fentanyl be a part of that, they might not even know they're using an opiate, and others around them might not know that Narcan would be useful, right? So there's messaging and things that we need to be working on to get that out. I think you may have seen that IPD just recently reported about that as well, that they were seeing a spate of overdoses related to some tainted street drugs. So it is a difficult issue. And to hear the family talk about their story obviously was heart-wrenching, and we're going to do some work around communications on it. We just have to kind of wrap our heads around what's the most effective way, because there is also the challenge, you know, as we've talked with our OASIS providers, that if you're talking regularly about drugs that are more significant for an opiate user, that could be a draw, right? Because they're looking for, you know, the drug that's going to get them the next best high. And if they're hearing that something is out there that is that could potentially give them that greater high, it could be a draw and have the opposite effect of what we're hoping to achieve. So it's a delicate situation, and communication has to be well thought out as we think about it. But we are working on it. Hope to get some information out.
thanks, Frank. Anything else? Yes. Okay. Any new business? Okay. Now we're going to move then to the enforcement actions. So our first one we have is Ty Basil. Can we get a motion in a second to approve as written? Okay, we have a first from David. And we have a second from Shauna. Okay, Liz, is there anything in addition to what's already in here that's important for us to understand?
No, this was penalties for and orders for failure to properly store hazardous food, they had food out of temperature on their counter, and the proposed fine is $200.
Any questions or discussion on this one? Okay. Make sure okay. Everyone in favor of approving as written? Anyone opposed? And Ravinder, you're in favor as written, right? Or opposed? Okay, in favor as written. No one opposed, and any abstentions? Okay. The second one, hold on, let me just scroll down so I'm make sure I'm looking at it. Okay, the second one was related to the Super 8. And so approval as written, a motion to approve as written. A first from David, a second from Ed. Let's go ahead and open for discussion. I think this one was mostly about fire safety, if I'm remembering correctly. Yes, and electrical systems. So Liz, I don't know that we've seen one of these recently.
No, you haven't. So they are required to, fire safety is very important, and they had fire and smoke doors that weren't maintained, and they also had were misusing electrical equipment like power strips and outlet covers. So we are proposing enforcement with a $400 fine.
Yes, Sue.
I just wondered, why haven't we seen it before? Is this something new you guys are doing, or you just haven't done fire inspections in a while?
Well, we were, during COVID, we did rely more on the code officers and fire inspectors to do these. So these are probably more situations that weren't corrected through other processes. The fire inspectors typically have a lot more knowledge on these things, and so we'll work with them on fire problems and things. But so these were things that hadn't been corrected and then were called out during the recent inspections, right? And weren't corrected between inspections.
Any other questions? Okay, everyone in favor as written? Anyone opposed? And abstentions? It's unanimous. Okay, the next one is the stipulation or the enforcement action against the Best Western. And so again, if we can get a motion to approve as written. I'll take first from Samara this time and a second from Ed. Okay, and this again is another, I think this was a little bit different, but emergency lights and batteries. So any additional discussion on this one, Liz, for us to be aware of? Because it is again, it was just a little different than what we normally see, but.
Yes, this one had been going on, and we did realize, anyway, we did up the level of the violation because they had not corrected it.
Okay.
And they also had a blocked door. That was another problem with this situation. So it's another $400 proposed fine.
Any questions on this one? Yes, Shauna.
Yeah, I believe during the summertime, Best Western had some issues with their swimming pool. Does this violation go on top of that other violation?
No, we view the swimming, like if they have a food service or a pool, those are separate from their temporary residence violations.
Okay, that's it. Thank you.
Any other questions or clarifications needed? Okay, all in favor as written. Anyone opposed? And abstentions? Okay. Next one, I think these last two are the smoking, the tobacco ones that Liz was referring to. So can we open up the first one? This is related to CNC chucks with a motion to approve as written. First from Shauna, a second from David. Okay, so Liz, did you want to talk a little bit about the stipulations in these now? I think you had started and I cut you off earlier. Or in this
Yes,
one.
so So we have increased the penalty to $500 plus the 250 state mandatory surcharge. So it does bring it to a total of $750. So that is a fairly significant increase over what we have charged in the past. And these, as I mentioned before, these are for sale of tobacco products to minors. So the more traditional ATUPA violation.
Yeah. Any questions on these or clarifications needed? Or on the first one that we're on, the CNC checks? Okay.
And as I mentioned, we do a lot more inspections, right? Once they have a violation. So that part will be, they'll be getting
I think it's a 3,
more
right?
chances to violate or more chances to be doing things right in the coming year.
Okay, all in favor of as written, approving as written? Anyone opposed? And abstentions? Okay, let's take a look at the next one, which again is similar. This one is for Smiley's Food Mart. Can I get a motion to approve as written? I got a first from David and a second from Ravinder. Is there anything in addition on this one, Liz, that's different than the first one that we need to understand? Okay.
Not really.
Questions? Okay. Any questions or clarifications from the group? Okay. All in favor as written? Anyone opposed? And abstentions? Okay. I think that was our last one, right? Yeah. Okay, Frank, back to you for merger updates.
Great. Thanks, Christina. And I wanted to keep this on your agenda probably here moving forward, just as a touch point to kind of fill you in on where we are and get feedback if you have any on process or anything you'd like to see us be doing differently. The first thing to start with is the branding effort. So the new name and logo. Sam, are we ready to announce the company? We are. So we went through an RFP process and selected a local company, Iron Designs. They've worked with some other nonprofits in our community. We like their approach. And so I think we've just finalized contract with them and are in the process of having our first discovery meeting, which will have representatives from the department, from both parts of the department, as well as there is a representative from the CSB. There's an opportunity if anyone from this board wants to participate in that, you're certainly welcome. Let me or Christina know. And so that process will be launching. We think it'll be roughly a 3-month process where there'll be some iterations going back and forth and understanding who we are and trying to figure out what will truly represent us, with our hope being that the legislature sometime in the summer will be, having the opportunity after you all have had a chance to weigh in to, give us the yes or no on whether they support the new name and logo that's been developed. Our hope is that our process will be transparent and we'll be keeping all of you, the Community Services Board and the legislature updated on the process and how it's going. So by the time we get to a final product, it'll be something everybody will feel comfortable supporting. So that's going on, which is exciting. We're also in the process of launching another cross-functional team around children and youth services. And so there seems to be some good energy amongst the different programs to do that. Senior leadership, the division directors have been having some introductory conversations to put some details around a potential charter for another cross-functional team to look at how can we better integrate and support the children and youth that we serve across all of our programs, which will also include some co-location of services, particularly having mental health services uptown at Brown Road. So there's a lot of excitement around that as well. as that work continues. We still have a cross-functional, so we have a cross-functional team doing the branding. We're looking to start a new one, and then we also have a cross-functional team that's been working on that Claire and Debbie are helping to support on kind of understanding each other and getting to back to the foundation of we need to have an idea of everything that everyone does in order to be able to successfully integrate what we're doing. And so Claire and some others have put together a network survey that's currently ongoing, where we're going to try to map who knows who and how, and then try to use that information to help us make more connections and get people comfortable with at least the basic knowledge of what services and opportunities are available in the department. So lots going on there. From taking a step a little bit higher, just to kind of give you a timeline on how we're working here is we'd like to go into 2023 as the new merged department. So there's a couple of things that have to get completed. Obviously the name and logo piece of it that I just explained, but the final step will be the legislature amending the charter for that will create this new single department, and that will address the legalities that are required for that. Met with Holly, Bill's deputy in the county attorney's office to kind of prepare them for that, what we're expecting there. I'm going to be drafting some language changes to the charter to turn over to them for review. And that drafting will come subsequent to and built upon the bylaws work that both the Community Services Board and the Board of Health are kind of in the midst of. So, working backwards, the charter vote will be the last thing that happens. Ahead of that, the bylaws should need to be updated and ready to go and ready for legislature approval. And so we're starting to get a time frame here where at the latest, we'd want to have the charter changes and the bylaws in a proposed form going to the legislature by no later than October. If we can do it sooner, that would be great. But in order to meet an end of year kind of deadline, a self-imposed deadline, we need to have that in front of the legislature by October for them to be able to go through their processes of review and approval. So that's kind of where we are in big picture. The only other thing that I would mention is the financial side of things. We are working with the Rick, the county financial officer, to talk about how we can merge our chart of accounts together, what will work in the systems that we have in place, which unfortunately it seems like the systems are going to be the limiting factor on how much we can actually integrate financially, or at least how easily we can do it. But we are having those conversations and planning is underway. So as we build the 2023 budget, we'll be building it in this new county, new chart of accounts that we're proposing. So that has to be done in the next couple of months. And Brenda and Jeremy are working with the finance office to kind of prepare for that and figure those pieces out. So lots going on in there. And I just wanted you guys to be aware and also offer, the opportunity, if anyone wants to be a part of that branding process, to let us know. And then Christine, I know you're kind of leading the bylaws portion of things.
Yeah, and I guess I was just going to jump in quickly on that to let folks know that I actually did do a first edit on those and then realized I needed some more information, which Karen just did get to me, and then it just went off my radar again. So it is now back on my radar. And so I'll get that first draft to, I think David, Evelyn, and Sue Merkel were the two that agreed to sort of take a look at it before it came back to the full board. So we'll just commit to getting that draft to the two of them to look at this week. And perhaps we can put a look at those edits on our April agenda for this board to take a look at. Frank, if you think that makes sense in terms of next steps after that initial edit.
Yeah, no, I think that makes sense. The only thing that I would offer is we do want to, in talking with Bill and Holly, as much as we can have the two bylaws be similar.
Yeah.
That, you know, that would be helpful. Things like terms of office and,
Right.
you know, all of that, you know, renewals and those kinds of things. So I think having at least a cross conversation with the CSP group that's working on it, just to align those things ahead of it coming to the full board. Because some of those are ministerial changes that might seem small, but if it get into conversation, folks might think are bigger.
Yeah, and I think that what we should do is what the board should expect in terms of what they would see in April is a marked up version of the bylaws, which would include some placeholders that will say things like this section needs to be aligned with the CSB bylaws without a specific information in there. But I think before we go to the CSB, I would sort of like the board to see where we are with it and make sure that we've got that we haven't missed something or there aren't changes that we want on this end. And then I think we can go to CSB and say, you know, here's where the Board of Health is with this right now.
Yep.
So,
Sounds good.
okay. Okay. Thanks, Frank. Okay, any questions at all for Frank on the merger or me on the bylaws stuff before we adjourn? Okay, well, I think we've covered everything on our agenda. So I'm going to go ahead and adjourn our meeting. And we'll see everybody in April, potentially in person. So please just make sure that, you know, you've blocked maybe 30 minutes of travel time or whatever it is you need to get up to the Board of Health in case you do have to be there in person. Okay.
Quick thing, will it be in the normal location in the health department?
Yeah, it'll be in the Brown conference room at the health department. We do have the technology set up with the TV and video, so it will still be on YouTube for the public to view that way. But the members have to be in person. We may have staff do it remotely just for space sake when we first start, but we'll work all those details out as it gets closer, but it will be in the Rice room at the health department.
All righty. Okay, thanks everybody. We'll see you in a month. Bye-bye.
Thank you.